Welcome back, everyone. We're diving into a world you interact with every single day, but probably don't give much thought to. Your oral microbiome.
It's pretty amazing when you think about it. Everyone always associates the word microbiome with the gut.
Right.
But the mouth actually houses the second largest and most diverse microbiome in your body.
It's a jungle in there.
It is.
And according to the World Health Organization, a crazy 3.5 billion people globally are dealing with oral diseases.
Wow.
With severe gum disease being one of the most common inflammatory conditions out there.
And that's why I'm so passionate about this. We're only just now starting to understand how deeply oral health is connected to our overall well-being.
Yeah.
It's not just about a pretty smile. It's about protecting yourself from all sorts of serious health issues.
Absolutely, and that's where you come in. We are super excited to have Dr. Victoria Samson with us today.
Yeah.
She's a dentist who focuses on the oral microbiome.
I do.
And let's just say she knows a thing or two about saliva.
Well, you got to have a passion for something. I am excited to really get into it, explore this fascinating world with you both.
Yeah, let's get into it. Let's start with some basics.
Yeah.
Can you give us a crash course on just how diverse this ecosystem in our mouths really is?
Absolutely. Just imagine your mouth as like a bustling city.
Okay.
Home to about 700 different species of bacteria.
Wow.
Totaling around 2 billion residents.
That is wild.
And every single thing you do, from breathing to eating to even kissing, impacts this delicate balance.
So every bite we take, every word we speak is influencing this microscopic world.
Exactly. And unlike your skin, which is constantly shedding cells and bacteria, your teeth, those are non-shedding surfaces.
That's true. I never thought about that.
Yeah, so this means bacteria can very quickly build up and colonize,
Right.
making those daily rituals, the brushing and flossing, really essential for disrupting those colonies.
We are essentially playing the role of city planners, making sure things don't get out of control.
We are.
But how does this, microscopic metropolis impact our overall health? You mentioned this fascinating mouth-body connection.
It is remarkable how interconnected these systems are. Let's start with just how easily bacteria can actually spread from the mouth to other parts of your body. Think about it.
Okay.
You swallow, you breathe, you even have tiny blood vessels in your gums. These are all potential escape routes for harmful bacteria.
So it's like a prison break for these microscopic troublemakers.
It is.
But instead of escaping to freedom, they're spreading throughout our bodies.
That's a great analogy. Once they're on the loose, they can contribute to inflammation throughout your entire system. This low-grade chronic inflammation can make existing conditions, like rheumatoid arthritis, even worse.
Oh, wow.
Acting like a constant irritant that keeps the immune system on high alert.
So that's not the only way these escapees wreak havoc, right?
Right.
What about this blood vessel damage you mentioned? That sounds particularly concerning.
It is. The toxic enzymes that are released by certain harmful bacteria can travel through your bloodstream and damage your blood vessels. Over time, this damage can have like a ripple effect.
Oh, wow.
Impacting everything from blood pressure regulation to heart health.
And that brings us to some of the really shocking links between oral health and major diseases, which I know you've researched a lot. For instance, the connection between gum disease and heart disease is something that I think a lot of people just aren't aware of.
Yeah, it's truly eye-opening. My research has actually found that individuals with poor oral health have a 9 times higher risk of complications from COVID-19.
9 times.
Yeah, 9 times, largely due to the dangers of bacterial superinfection. And this just highlights how vulnerable our bodies are when our oral microbiome is out of whack.
That's a staggering increase.
It is. And when it comes to heart health specifically, those with gum disease are 20% more likely to have high blood pressure.
Wow.
And in fact, a significant percentage of cardiac issues that are seen in hospitals can be traced back to the presence of oral bacteria.
That's wild. It sounds like neglecting your oral health could literally be putting your heart at risk. But how does this actually happen?
So the bacteria responsible for gum disease can actually enter the bloodstream through inflamed gum tissue.
Oh, wow.
And once in the bloodstream, they can travel to the heart and contribute to the formation of plaque in the arteries, a major risk factor for heart attacks and strokes.
So these tiny organisms in our mouths could be playing a role in one of the leading causes of death worldwide.
Yeah, it's a sobering thought. People with gum disease are twice as likely to have a heart attack.
Really?
And 3 times as likely to have a stroke compared to those with healthy gums.
Those statistics are pretty hard to ignore. And I know we've got a lot more to unpack here.
We do.
What are some of the other surprising links you've uncovered in your research?
Well, for one, there's a connection between oral health and erectile dysfunction.
I bet that gets people's attention.
It does.
What's the link there?
So men with periodontal disease are 2.85 times more likely to experience erectile dysfunction.
That's almost 3 times more likely. How is that even possible?
It all comes back to those damaged blood vessels we talked about earlier. Reduced blood flow caused by those damaged vessels can make it much harder to, well,
Okay, I think we get the picture. Moving on, you've also uncovered some fascinating findings linking oral bacteria to certain types of cancer, right?
Yes. This is cutting-edge research that has the potential to really revolutionize how we approach cancer treatment.
What have you found?
So my research, along with others in the field, has revealed a potential link between the oral bacteria Fusobacterium nucleatum
Okay.
and both breast and colorectal cancers.
Wow.
And what's particularly concerning is that this bacteria doesn't just reside in the mouth. It can travel to other parts of the body.
So instead of just causing problems in the mouth, it can migrate and potentially contribute to the development of cancer elsewhere.
That's right. And in many cases, we're seeing that tumors with F. nucleatum present actually grow more aggressively and are more resistant to treatment. This suggests that this tiny bacterium could be playing a significant role in how cancer develops and progresses.
That's incredibly disturbing, but also incredibly fascinating.
It is. It really underscores the critical importance of understanding and caring for our oral microbiome.
Well, I know you've done a lot of research into another major health concern, Alzheimer's disease.
Right.
What role does the oral microbiome play there?
Unfortunately, the link between long-term gum disease and Alzheimer's risk is becoming increasingly clear.
Okay.
Research has shown that having gum disease for over 10 years increases your risk of developing Alzheimer's by a staggering 70%.
70%. That's a truly frightening statistic. Is this also connected to F. nucleatum?
It's actually another culprit in this case, Porphyromonas gingivalis, or P. gingivalis for short. This bacterium is particularly harmful because it can travel to the brain.
Wow.
And cross the blood-brain barrier.
The blood-brain barrier, that's the protective shield around our brains, right?
Exactly.
Yeah.
Most bacteria can't penetrate it, but P. gingivalis can. And once it's in the brain, it releases these harmful enzymes called gingipanes that directly damage neurons.
So it's not just about inflammation in this case. It's about direct damage to the very cells that make up our brains.
Exactly. And while we don't have all the answers yet, we know that maintaining good oral health, even for those already diagnosed with Alzheimer's, is crucial. Gum disease can accelerate cognitive decline, making those gingipanes even more destructive.
That is terrifying and really puts into perspective the potential consequences of neglecting our oral health. You've actually developed a test that can detect these gingipanes, haven't you?
Yes, it's a unique test that helps us get a much clearer picture of an individual's risk for cognitive decline associated with oral bacteria.
This is all incredibly fascinating.
Yeah.
And honestly, a bit overwhelming. It seems like these tiny organisms living in our mouths have the power to influence so many aspects of our health.
They do.
What can we actually do with this information?
Well, that's a fantastic question and one we're going to dive into right now.
Okay, I'm ready.
Let's jump right into the practical steps you can take to optimize your oral microbiome and protect your overall health.
Okay, let's hear it.
Let's start with the foundation of a healthy oral microbiome, your diet.
All right, let's talk diet. We all know sugar is bad for our teeth, but how does it actually impact, that ecosystem in our mouths?
So sugar, it essentially fuels the growth of the harmful bacteria in your mouth.
Okay.
As these bacteria feast on the sugar, they produce acids.
Right.
And these acids attack your tooth enamel.
Oh, wow.
Leading to cavities and weakening the teeth. Think of it like a sugar attack on your pearly whites.
Okay, so is the answer just to completely avoid sugar?
Well, while eliminating sugar entirely would be amazing, I'm also a realist. The key is to minimize the duration of those sugar attacks.
Okay.
So instead of sipping on a sugary drink for hours, try to consume it all at once. This will give your saliva a chance to neutralize the acidity and restore a balanced pH in your mouth.
That's a really helpful way to think about it. It's not about deprivation, it's about making smarter choices.
Exactly.
Any other dietary tips that can help us kind of cultivate a healthier oral microbiome?
You might be surprised to learn that mouth breathing can actually have a significant impact
Really?
on your oral health.
I've never thought about that before.
Yeah.
What's the issue with mouth breathing?
So when you breathe through your mouth, it dries out your saliva.
Okay.
And saliva is essential for maintaining a balanced oral microbiome
Okay. Yeah.
because it contains antibacterial compounds and it helps wash away food debris. When your mouth is constantly dry, it throws that balance off, making you more susceptible to gum disease, bad breath, all sorts of issues.
So saliva acts as a natural defense system,
It does.
and mouth breathing is essentially sabotaging it.
Exactly, exactly. And there's emerging research, more studies are needed to fully understand this, but there's a potential link between mouth breathing and conditions like ADHD and sleep disorders.
That's fascinating and a little concerning. I'll definitely be paying more attention to how I'm breathing from now on.
Yeah,
You mentioned earlier that even kissing can impact the oral microbiome.
it can.
What's going on there?
Well, when you kiss someone, you're exchanging more than just a sweet sentiment.
Right.
You're also swapping bacteria.
So a kiss is kind of like a microbial meet and greet.
Exactly. While a quick peck probably won't drastically alter your microbiome, frequent and passionate kissing, especially with a long-term partner, can lead to a more synchronized oral ecosystem.
Really? That's so interesting. What about oral sex? Does that also come into play when we talk about the oral microbiome?
Absolutely, it does. Just like kissing, oral sex involves the exchange of bacteria, and this can have, implications for both partners.
Yeah.
For example, if one partner has an imbalance in their oral microbiome, it could potentially be passed to the other.
That's a good reminder that open and honest communication with your partner about any oral health concerns is important.
It is.
Not just for emotional well-being, but for physical health as well.
Absolutely. Honesty and transparency are key. Now let's shift gears a little bit and talk about something I know you're particularly interested in, product recommendations.
Yes. As our listeners know, I am always on the hunt for the best tools and products to optimize my health.
Of course.
So what are your top picks for maintaining a healthy oral microbiome?
Well, first and foremost, I encourage everyone to ditch the manual toothbrush and embrace the power of electric.
What makes electric toothbrushes so superior?
Electric toothbrushes are simply more effective at removing plaque and bacteria.
Okay.
They also have built-in timers, usually, that ensure you're brushing for the full 2 minutes, as recommended by dentists. And a lot of models have pressure sensors to prevent you from brushing too hard, which can damage your gums.
So it's like having a personal trainer for your teeth,
Exactly.
guiding you to better technique, making sure you're putting in the work.
You got it. Now, this next one might surprise you, but unless specifically prescribed by your dentist, I actually advise against using mouthwash regularly.
Really? Why is that? I always thought mouthwash was essential for killing bacteria and freshening breath.
Well, it's true that mouthwash can kill bacteria and freshen breath. The problem is most mouthwashes are indiscriminate in their approach. They kind of wipe out both good and bad bacteria, disrupting the balance of your oral microbiome.
So it's like using a weed whacker when you really just need a pair of pruning shears.
Perfect analogy. If you're concerned about bad breath, try chewing sugar-free gum with xylitol or using a tongue scraper to remove bacteria from the surface of your tongue. These are gentler approaches that won't disrupt your oral microbiome.
Good to know. What about toothpaste? Any ingredients we should be on the lookout for?
Yes. One ingredient to avoid is sodium lauryl sulfate, or SLS. It's a foaming agent found in many conventional toothpastes.
Right.
But it can be harsh on those delicate tissues in your mouth. SLS can strip away the protective mucosal lining, making you more susceptible to irritation and inflammation.
So it's important to choose a toothpaste that cleans effectively, but is also gentle on that delicate environment in our mouths.
Exactly, exactly. Now, speaking of gentle and effective, you mentioned xylitol earlier.
Right.
Xylitol is a natural sugar alcohol that, unlike sugar, doesn't feed the harmful bacteria in your mouth.
So it doesn't contribute to those sugar attacks we talked about.
Not at all. In fact, xylitol actually inhibits the growth of harmful bacteria and may even help to remineralize tooth enamel.
Oh.
It also stimulates saliva production, which further helps to neutralize acidity and wash away food particles.
Xylitol sounds like a real superhero for oral health.
It is.
Yeah.
Now, I know you're kind enough to share the results of your personalized oral microbiome test with me.
Right.
And I've brought along some specific product recommendations based on your unique bacterial profile.
That's so thoughtful. Okay, let's see what you've got.
All right. Well, first up, we have good old green tea.
I have to admit, I'm more of a coffee person.
I understand. But hear me out. Green tea isn't just good for your overall health.
Okay.
It's also amazing for your oral microbiome.
Really?
It contains compounds called catechins, which are naturally anti-inflammatory and antibacterial, and they're especially effective at combating that pesky Fusobacterium nucleatum we talked about earlier.
The one that's linked to cancer.
That's the one. So sipping on green tea could be a simple yet powerful way to keep those harmful microbes in check. And to make it even easier, I've also brought along some chewable mints that contain both green tea extract and xylitol. They're great for freshening your breath on the go, while also giving your oral microbiome a little boost.
Oh, I love that. Okay, what else do we have in this treasure chest of oral care goodies?
Let's see. Ah, yes, prebiotic floss.
Prebiotic floss. I've never even heard of that.
It's a relatively new innovation, but it's a game changer. This floss is infused with prebiotics, which are essentially food for the beneficial bacteria in your mouth. So as you're flossing away plaque and debris, you're also nourishing the good guys.
So we're not just cleaning our teeth, we're actually feeding the good bacteria.
Exactly. And lastly, I have a couple of different toothpaste brands that I think would be a good fit for you based on your test results. One of them is Biomin. Have you heard of it?
I don't think so. Tell me more.
So Biomin is unique because it uses a special technology to deliver calcium phosphate and fluoride to your teeth,
Okay.
which helps to strengthen enamel and reduce sensitivity. And it does this with a much lower concentration of fluoride than traditional toothpaste.
So it's a gentler, more targeted approach to fluoride protection.
Precisely. This is a great option for people who are concerned about the potential downsides of high fluoride exposure.
Dr. Samson, this is all incredibly helpful. But with so many different products and recommendations out there, it can feel overwhelming. Where do I even start? What's your advice for someone who really wants to take their oral health to the next level?
You know, my top recommendation would be to find a dentist who specializes in the oral microbiome.
Okay. They can provide really personalized advice and treatment plans based on your unique needs and test results.
That makes a lot of sense. Are there a lot of dentists who specialize in this area?
You know, unfortunately, it's still a relatively new field.
Yeah.
But more and more dentists are recognizing the importance of the oral microbiome and incorporating it into their practices.
You've actually founded a clinic that focuses on this holistic approach to oral health, right?
I have, yes. My clinic, the Health Society, really aims to bridge the gap between dentistry and medicine. We understand that oral health is so intricately connected to overall well-being, and we offer a range of services, from oral microbiome testing to nutritional counseling, all with the goal of helping our patients achieve optimal oral and overall health.
That sounds like an incredible resource. But what about listeners who aren't located in London?
So we're actually currently working on making our oral microbiome test available worldwide.
In the meantime, I encourage everyone to do their research. Seek out dentists who are embracing this cutting-edge approach to oral care.
We'll be sure to link to your website and social media so our listeners can connect with you and learn more.
Thank you. I appreciate that.
Dr. Samson, this has been such an eye-opening conversation. I feel like I've learned so much about this hidden world in our mouths.
It has been my pleasure.
And its profound impact on our health.
Before we wrap up, I have one last question for you. What's the one most important takeaway you want our listeners to remember from our deep dive today?
Simply put, your mouth is a gateway to your overall health.
That's a good one.
By taking care of your oral microbiome, you're not just protecting your teeth and gums.
Right.
You're investing in your long-term well-being.
We've covered so much today.
We have.
From the crazy diversity of our oral microbiome to those surprising connections to major diseases like heart disease, cancer, even Alzheimer's. It's so clear that this, often overlooked ecosystem really plays a big part in our overall health. It's amazing how interconnected our bodies really are. And what's so exciting is we are moving towards a future where dentistry and medicine are kind of seamlessly integrated.
Yeah, like your clinic, the Health Society.
Yeah.
It's so incredible to see how you're using saliva testing, not just to assess oral health, but to get valuable insights into the body as a whole.
Exactly. Imagine a world where just a simple saliva test at your dentist's office could provide early warning signs for all sorts of conditions, heart disease, diabetes, even Alzheimer's. That's the future I see, a future where healthcare is more personalized and preventative. And it all starts with understanding what's happening in our mouths.
It's an inspiring vision.
Yeah.
It makes so much sense. So as we wrap up this deep dive into this fascinating world of the oral microbiome, what's one small change our listeners can make today to start taking better care of this hidden ecosystem and, in turn, their overall health?
Honestly, the simplest and most effective change you can make is to switch to an electric toothbrush. It's an investment in your oral health. And as we've talked about today, that's an investment in your overall well-being.
And maybe swap out that sugary soda for a cup of green tea every now and then.
Absolutely. Every little choice makes a difference.
It does. It really does. So knowing what you now know about the far-reaching impact of your oral health, what small change are you going to make today to start cultivating a healthier, happier you? Until next time, keep exploring, keep learning, and keep diving deep.